Ginger is often praised as a superfood, but did you know that for some people it can actually be harmful? Have you ever experienced heartburn, an upset stomach, or even dizziness after consuming ginger? Could this common spice be silently affecting your health? Many people assume that because ginger is natural, it is always safe. But this isn't entirely true. Stick around to learn the hidden dangers of ginger, who should avoid it, and when it's the worst time to consume it. Before we get started, don't forget to like this video, subscribe, and hit the notification bell so you never miss out on essential health updates. Ginger has been used for centuries in traditional medicine to treat nausea, inflammation, and even digestive issues. However, consuming it in excess or under certain conditions can lead to serious health problems. While it offers many benefits, it's important to understand when and how it can become a risk to your well-being. So, who should be cautious when consuming ginger? Let's begin with one of the most overlooked dangers: its effect on blood clotting. Ginger contains salicylates, which act as natural blood thinners. For people on blood-thinning medications such as warfarin, aspirin, or clopidogrel, consuming large amounts of ginger can increase the risk of excessive bleeding and bruising. Studies have shown that ginger can interfere with blood clotting, making it a risky choice for individuals with clotting disorders or those scheduled for surgery. So, who should be cautious? 1. People taking anticoagulant medications. Combining ginger with blood thinners can make even minor cuts bleed excessively, making wound healing difficult. Secondly, those with hemophilia or other blood disorders. Conditions that affect blood clotting can be worsened by ginger's anticoagulant effects, leading to serious complications. 3. Individuals preparing for surgery. Medical professionals recommend stopping ginger consumption at least 2 weeks before surgery to reduce excessive bleeding risks. But did you know that ginger can also irritate the digestive system? Let's move on to its impact on acid reflux and stomach ulcers. Ginger is often used to soothe digestion, but for individuals with acid reflux, also known as GERD or peptic ulcers, it can have the opposite effect. Ginger increases gastric acid production, which can worsen heartburn, bloating, and irritation of the stomach lining. A study published in the World Journal of Gastroenterology found that excessive ginger consumption could lead to gastric irritation in sensitive individuals. Who should limit ginger? People with GERD increased stomach acid can make acid reflux symptoms much worse, leading to discomfort and pain. Those diagnosed with stomach ulcers, the extra acid production triggered by ginger can further erode the stomach lining, making ulcers worse. Individuals prone to bloating and indigestion. Some people experience bloating and gas after eating ginger, making digestive discomfort even more pronounced. If ginger can irritate the stomach, what about its effect on blood sugar? Let's take a look at how it impacts diabetics. While ginger is often recommended to help regulate blood sugar levels, it can be dangerous for diabetics who are already on blood sugar-lowering medications. Ginger enhances insulin sensitivity, which could cause blood sugar to drop too low, leading to dizziness, fainting, and weakness. Who should be cautious? People taking diabetes medications like metformin or insulin. Combining ginger with these medications may lower blood sugar too much, resulting in dangerous hypoglycemia. Those prone to low blood sugar episodes, symptoms like shakiness, confusion, and extreme fatigue can occur if blood sugar drops too low. Individuals with fluctuating glucose levels. If blood sugar levels are unstable, ginger could make it harder to maintain balance. Since blood sugar control is affected by when we eat, let's explore the worst times to consume ginger. Timing matters when consuming ginger. There are times when eating ginger could do more harm than good. On an empty stomach, ginger stimulates digestive juices, which can cause irritation, bloating, or stomach cramps when there is no food to digest. Before bedtime, its stimulating properties can cause restlessness or difficulty sleeping, especially for sensitive individuals. Before surgery or medical procedures, as mentioned earlier, ginger thins the blood, increasing surgical risks. Ginger also carries specific risks for pregnant women. Let's discuss why expecting mothers need to be cautious. Pregnant women are often advised to consume ginger to reduce nausea, but excessive intake could lead to contractions, increased bleeding risk, and even miscarriage in some cases. According to the American Journal of Obstetrics and Gynecology, consuming more than 1,000 milligrams of ginger per day could increase the risk of complications. Who should be cautious? Women in their first trimester of pregnancy. High doses may trigger contractions, increasing the risk of miscarriage. Next, those with a history of miscarriages. Women who have previously experienced pregnancy loss should avoid ginger to prevent complications. Also, pregnant women on blood-thinning medication. Ginger has anticoagulant properties, and research has shown that it can increase the risk of bleeding during pregnancy. Since ginger can interact with pregnancy, what other medications does it interfere with? Let's find out. Ginger can interfere with several medications, altering their effectiveness or increasing side effects. Some notable interactions include high blood pressure medications like beta blockers and calcium channel blockers. Ginger can lower blood pressure too much, causing dizziness and fainting. Diabetes medications. As mentioned earlier, ginger can lower blood sugar, leading to hypoglycemia when combined with diabetic drugs. Antacids. Since ginger stimulates acid production, it can make heartburn and acid reflux medications less effective. With so many risks, how can ginger be safely consumed? Let's go over some tips. Despite these risks, ginger is still beneficial when consumed properly. Here's how to enjoy its health benefits safely. Limit daily intake. Stick to 1 to 2 grams of fresh ginger per day to avoid side effects. Pair with food. Always consume ginger with meals to prevent stomach irritation. Monitor your body's reaction. If symptoms like heartburn, dizziness, or stomach pain occur, reduce or stop consumption. Consult a doctor. If you are taking medication or have an existing health condition, seek medical advice before consuming ginger regularly. While ginger is a powerful natural remedy, it's not for everyone. Certain people, those on blood thinners, diabetics, individuals with GERD, and pregnant women, need to be cautious. Knowing when and how to consume ginger is key to reaping its benefits without suffering from its potential risks. If you found this information helpful, make sure to like this video, subscribe to the channel, and hit the notification bell so you never miss our latest health updates. Share this video with friends and family so they can stay informed too. Have you ever experienced side effects from ginger? Let us know in the comments below.